Hi, I am the program director for Mama's Voices, Nicole Purnell, and thank you for joining us to watch a replay from one of our AIM Extension webinar series that was hosted in August of 2023. We want to thank the AIM program for their support and trust with the lived experience integration into quality improvement community learning. These materials were developed with support from the Health Resources and Services Administration, or HRSA, of the U.S. Department of Health and Human Services, HHS, a part of the cooperative agreement with the American College of OBGYNs, under grant number UC4MC28042, Alliance for Innovation on Maternal Health. The contents do not necessarily represent the official views of, nor endorsement by HRSA, HHS, or the U.S. government. For more information, please visit HRSA.gov. And now we'll get back to our webinar.
Appreciate it. And I'm going to hand this over to Tara. Here is her title slide, but letting you know that Tara has been a long time partner, I will say co-conspirator with Mama's Voices. We love working with Tara, and she has just an amazing background of working with making sure that patients are included in quality improvement projects and working with clinicians as well to find that sweet spot for them. So she comes to us from North Carolina, and I'm going to let her share some more about herself and then her presentation today. She is just fantastic. And again, thank you, Tara, for being here. And I'm going to turn it over to you, and I'm just going to keep letting people in.
Sounds great. Thanks, Nicole. It's a pleasure to be here with y'all. It's so good to see so many familiar names and faces popping up as well. So for those I haven't had the privilege of meeting yet, as Nicole said, I'm Tara Rouse. I've worked with Mama's Voices for many, many moons now. I 18 years ago kind of started into this world of patient-family partnership after my own maternal experience, and my son stay in the NICU. And from that, started working as on a voluntary basis to help develop family advisory boards, and do that at the unit level and then the hospital level. And now I've been supporting effort for patient and family engagement on the state and national level for many years. Today I'm kind of we can never take off all of our hats and only wear one. So I've got all of those things. And today I'm with this kind of focus on safe space, and what you'll soon learn is focus on communication. I'm also coming as faculty in training for the Academy on Communication in Healthcare, and have found it so many resources and tools valuable to the work we do in this space. So Nicole already invited you to share your name and where you're from. If you feel so compelled, feel free to also share your roles or organizations. I'm always looking to learn more about how many patient family partners we have in the room, and supporters of quality care collaboratives, and other roles there might be. So feel free to share that and any goals you might have for today and our time together. So our time is short, but I would like to also do some good engagement and collaboration too. So we'll use the chat box, but let's see, here we go. All right, the first one, as you think about the title of this webinar, and what you think about when you hear safe space, and what that looks like in terms of collaboration. I would love to hear from you using your chat box. When we talk about safe space for collaboration, what does that look like? What does it feel like? Go ahead and put that in the chat box, and I'll be looking here to see what that means to you. Rochelle, thank you. Judgment free. Yes, that feels like a safe space, doesn't it? Transparency. Annette says trauma informed, open minded. Rhonda says freedom to be self. I love that. Inclusion and belonging. And Sarah, yep, inclusion, inclusive. I love these words and phrases that we're seeing come up. Non-biased, diverse representation with open communication and minds and active listening. Feel free to add some additional items as you think of them, but yes, all of those things you shared feels like a very safe space to be in. Judgment free, get to come being yourself and being respected and listened to and appreciated for all of those things, validated. So thinking about that and what we think it means to create this safe space for collaboration, I think it's helpful to actually back up a step and think about, us coming together in collaboration. Why is it that we're doing that? Well, it's to hear these stories from women, to hear from women and their families, things that they've experienced, so that we can make the healthcare system better. And we know that while there's much to be celebrated and so many successes that are part of that, there is also a depth of hurt and harm connected to that too. Just actually 2 days ago, getting ahead of myself. Some of you may have seen the report that came out from CDC Vital Signs. I mean, literally, this was Tuesday. This came out, so this is hot off the presses. And it was based on survey results from about 2,400 women, and this was all English speakers. So that clearly tells you that we're also we're missing some data here. But based on that, those 2,400 women, you can see that 1 in 5 women report mistreatment during maternity care. And as you look here, and I'm thinking about some of the things that came into the chat box, and about how, as we create these spaces, they need to be diverse and inclusive. This is exactly why, when we're talking about mistreatment, it's disproportional. I would imagine that probably is not a shock to anyone on this call. And if we go further into that, so when we say mistreatment, what does that mean? Well, here are some of the most common things that came up in that report. They received no response to requests for help. They may have been shouted at or scolded. They didn't have their physical privacy protected, and they were even threatened with withholding treatment or made to accept treatment that they didn't want. One of the other things that was reported, so if we know that 1 in 5 receive that mistreatment, we know that of the entire group, that also 29% reported discrimination based on race, weight, income status, education. 45% of the women from that group reported holding back from asking questions or discussing concerns with their provider during maternity care. 45%, so nearly half of those women. And the most common reasons included that they were thinking, or they had been told, oh, that's all just normal. It's normal. Everything's just as it should be. Or they didn't want to make a big deal about something, or maybe it was a concern that they were embarrassed to bring up. Some of these women felt like their physician or provider would think they were being difficult, or they felt like their provider was in a rush and maybe didn't have time to answer their questions, or they felt like they weren't confident in what they were talking about. Thinking about all of these things and pulling all of that data together. So we're asking women to come to the table and collaborate with us, and these are the things we're asking them to talk about. So then we're connecting that with, what does that mean? How do we create a safe space for these conversations where we're not causing any further trauma, harm, loss, that it's these trusting, respectful, inclusive environments that you all spoke about. How do we do that? Well, when we look back at the CDC report, they talked about, at the bedside, if we're looking at how to improve care there between providers and staff and the women, they said effective communication was key among healthcare providers, patients, as this can build trust, contribute to high quality care. So that allows us to feel comfortable as patients sharing our concerns and leads to more accurate and timely treatment. So taking that from the bedside to the boardroom, and the focus of our conversation today will really be on this beginning part. Effective communication builds trust and contributes to high quality care, because it allows us to have those conversations that are difficult. And so it's our job through that communication to create those safe spaces. So let's talk a little bit about this and how do we create connection through communication. And I think it all starts out with just doing some level setting related to relationships. So typically when we think about relationships, we might think about ourselves in the middle, in our relationships, what that looks like with other people in our spheres of connectivity. So whether it's part of a project team, it's part of our staff at PQC, it's our nursing friends, it's our individual connections with those people. But we know when we're looking at teams and the work that happens with teams, that it's actually really important, and where we're going to see most effective communication and most meaningful work that happens is when we're not just aware of how we're connected to other people, but how they too are connected to each other. How many of us can say we know what the relationships are like between two of our coworkers? Sometimes, for sure. Other times we have no idea. And we know there's more communication happening between those closer relationships. This is just a smidge of what comes out of, there's a whole body of work on relational mapping and coordination, and I could spend days talking to you all about this. But I think the important takeaway here is understanding what all of those relationships look like, and that's what brings us together, that cohesion. That's where the work happens. So thinking about that, the importance of relationships and what that looks like, think about our typical model for engaging patient partners. A lot of times here we've got this individual who's experienced trauma, physical, emotional, mental trauma related to their maternal experience. And we want to engage them in our work. We want to make things better, and we know we can't do it without them. And so if we are really working hard at that, we identify a patient liaison or point of contact or whatever nomenclature you want to use for that. A person who's going to make sure that they have all their questions answered, that they know where to go, when to be there, where to park, what to wear, whether lunch will be served, what the stipend's going to be. That's the individual that they build connection with. And then they come to our meetings and hear all these people who have connections with each other. And we're looking at this patient partner saying, tell us all the things that were hard about your experience. and how we can make them better. And we're asking this of a person who has not built those relationships and trusts and connections in the way that maybe we have, and maybe we haven't sometimes too. But this is what we're going to focus on is how do we engage that patient partner? How do we use communication to build those relationships? Because that is the foundation for trust. We cannot have trust without that. I already said this related to the relational mapping and that, but truly when it comes to trauma-informed communication, nonviolent communication, relationship-centered communication, we could spend weeks and months and years together learning about all of these things. As I sit here, I've been working on projects related to psychological safety. I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 books on my 12 books on my desk right now that I've been utilizing in developing some workshops. And that can feel really overwhelming. So today it's really about picking a couple of things that are really impactful and really meaningful and giving you those tools that you can start to integrate into the connections that you have with patients. The beauty of it is these things work both at the bedside as well as when you're sitting together in the boardroom working on committees or as part of advisory teams or whatever the work is. And as an added bonus, this works not only with the patient family partners we're working with, it works with your coworkers and your family members and all of those things too. So lots of bonuses around here. But overall, we're going to talk about 2 powerful practices and some tactics underneath both of those. So we're going to talk about building ground of health and talk about rapport building and checking in, and those 2 as different things. We're also going to talk about responding with empathy and 3 specific things that can be utilized to do that. So my hope is that as we walk through these, that you'll be able to pick some a couple things that you go, you know what, I can start trying to do that tomorrow. I love this post-it note to do so many things. We are also overwhelmed that I think, practically speaking, building relationship, using relationship-centered communication has to happen within the work we're already doing, the things that we're already doing every day, and it's just how we do it. It's not adding things to do, it's just doing things a little bit differently. So that is the hope in what we'll be walking through together. So let's start with building ground of health. So, I'm sure probably when you thought about safe spaces in the context of this work in maternal morbidity and mortality, we're thinking about how do we protect and support and love on typically these women or family members who are sharing their most vulnerable moments in life. So that would be some deep stuff, and we're going to get into some deep stuff. But one of the things we know to be true, this is true with everyone, is we've got to start with the small stuff. In my world in healthcare communication, we talk about ground of health. So it's always starting out every meeting, every encounter with connection. That's how, and some, as we get into it, y'all will be like, well, those are just icebreakers. Well, these are icebreakers with purpose. It's about relationship. And I think sometimes when we talk about, oh, we're going to start every meeting with an icebreaker, people go, but it really is in these small moments that we're able to start to build that trust and connection. So small talk before big talk. And I'm going to give you some examples of what that might look like. First, we're going to talk about rapport building, which is getting to know one another in a different way. You think about meeting, especially if you're thinking about quality improvement committees or groups, and you come and you may do a introduction and here's my role, here's my purpose, here are my credentials, and that may be how you get introduced to each other. We don't often have the time or build in that opportunity to connect as humans. And when you think about that little pushpin patient partner over here, they just through natural communication and connection are probably doing this rapport building, right? But when is that individual patient partner getting to do it with the rest of the group? Well, this is how you do it. This becomes part of all of your phone meetings, your virtual meetings, your in-persons. It's a small, simple thing you can do. You can do it by chat. You can do it depending on the size of the group and how much time you have. Maybe you just have a few people share. But these are some of the things that questions that I so adore. So a food that reminds you of home. And that probably conjures up ideas for some of you. And I know it's like lunchtime for a lot of you out there too. So sorry, y'all who are on here live, maybe making you hungry. But when you ask people to share a food that reminds them of home, it starts conjuring up just a lot of what makes them who they are as a human being, and allows for me as a patient partner to help me connect with the patient safety officer in a really different way as humans, not as how might they help me with improving care through their role. Other examples, something about your name that you value. If you could be a whatever it might be, if you could be an animal, what would you be? One of the I've heard other people use, if you could be an ice cream, what would you be? Or if you could be a cheese. I grew up in Wisconsin for a good part of my childhood, so cheese is one that I love. A person you admire greatly, an object that has great meaning to you. And that's one that I think is kind of nice. I know during virtual times, people would be sitting at a desk or someplace in their homes during the pandemic. We'd ask people to share that on calls, and they would actually pick up objects and say, this is something that means something to me, and here's why. Making those perfect at those close connections. I was on a call the other day, and one of the other facilitators asked people to share their favorite flower. And I was able to not just learn that we had like this gentleman who is a master gardener who is raising birds of paradise on a call. How would I ever know this about this data analyst if we hadn't engaged in this rapport building? Really small, minute things that build those connections and relationships. So this is related. It falls under what I would consider those ground of health activities, but doing a check-in, and these are things you might do. When you're first convening a group. Maybe there's some. I often like them for when maybe there's some excitement or anticipation, and what are we expecting? Or maybe it's when we're kind of all coming to a conversation and maybe there's some angst involved in that. So I'll give you some examples here. I think this one, especially as you have patient family partners who maybe are traveling with you, or maybe even just coming to an in-person meeting and have traversed to your hospital or public health department for a meeting. What did you have to leave behind to be here? What would you otherwise be doing? Another one, this one's a good one for, I know, teams when maybe they don't feel so safe, but they're trying to create the space for hard conversations. They might use, what is your weather report? So how are things in your world, professionally or personally today? It could be, well, thunderstorms currently, but there's a 50% chance of sunny skies in my future this afternoon. I like that I picked the little image of the little boy here where he's got his like thunderstorm skies and his sunny skies. But it's a way to share kind of, where am I? How are you doing? What's on your mind? That's one that I didn't include on here, but that's one that we ask a lot of each other in some of our work with the folks in healthcare communication is what's on your mind? What's distracting you? What's keeping you from being fully present? And you may learn about sick family members, a dog that needs to go to the vet, that it's the first day of school, like Nicole was saying, or I just got back from vacation and I've got a million things in my head. So what's allowing you to be present, or what's keeping you from being present? Word necklace. Some people hate these. I think it's because they hate the name word necklace, some of my colleagues, but it's just a one word, like popcorn. Like, how do you feel about how the meeting went? One word. Curious, excited, motivated, disappointed, questioning. So you'll hear all these kind of different popcorns in that, and that's a nice way to kind of get a pulse check on where everyone is. How far are you away from home? Good for some of those in-person meetings. How much sleep did you get last night? How long was your commute to get here today? So different ways of checking in, making that human connection with people so that your patient partners are able to learn about and develop relationships with people in the room that they wouldn't otherwise have the opportunity to. And, as we think about this and, as trust and the building blocks. So those little tiny blocks, those little ground of health moments of building rapport and checking in, that is what is going to get us to the point where when we are having those discussions that are heavier, and our patient partners feel like they're taking more of a risk because they're being vulnerable, that's laying the foundation for these pieces. And we're going to get into how to support, how to create those spaces using communication techniques for those more difficult places. But I'd love to know, so I shared a couple of round of health, icebreakers, whatever you want to call them, activities. Would love for you to chat in. Are there other things, other ways that you build relationship ground of health that you would want to share that you like or have worked well? As we wait for our folks to chat in, I'll share too that so it was interesting. I had done with this group it was a group that was really struggling with their relationships with each other. Everything was very transactional between them. And so one of the openings we did for a meeting with them was what's a food that reminds you of home. And there was this really cool connection that happened between a couple of the people. They were like, oh, your mama made sweet potato casserole too? Like, we're going to have a sweet potato casserole, like, bring both recipes and try them all out. Everyone should be. And so it turned into this cool way that connections were built. And then, so for their next in-person meeting, they had planned to bring these dishes for that to share. But and one of the individuals who was, I just talked to her the other day, who was on that call, and we were talking about something else, doing some planning. And she said, Tara, I thought about you when I was on the, it was like a commuter train. the other day. And I said, what made you think about me when you were on the train? She said, well, there was this smell that I encountered. And I was like, oh gosh, what's she going to say about this? I know we had never been in person together. So I was like, where's this going? And she described that it was a smell that reminded her of her childhood. And this plant that was near their home, and when she would be outside during a certain time of year, it takes her right back to that place. And she said it made me think of, though, what tastes like home. And and she said, I'm going to use that for next time we do a round of health activity. So I think that was a cool connection, and that not only did it take her back to that exercise and take her back to that place and give her inspiration for next time too, but she and I have this new cool connection where she's thinking about me when she has this, scent memory on the train too. So these little things. Rhonda, thanks for sharing. She wrote, start with sharing about yourself first to open up access of sharing. If you're comfortable sharing your vulnerability, it creates space for them to do the same. Compliments can build ground of health. Yes, love both of those. And you're right. So as a facilitator, oftentimes I will start with whatever my answer to whatever the question is. So that's a great practice to build trust and share vulnerability, which is, I think, what Nicole put in the chat box too. All right, so thinking about some of the heavier stuff, 3 of the things, because inevitably, we're in this space where stories are shared, and rarely is a story shared, especially in the type of work that we're doing, where there isn't emotion associated with it. That said, we don't always name it. We don't always call out the emotion that we're seeing. I could see it right in front of my eyes, and maybe I feel like I don't know what to say, or I'm going to get it wrong, or but the result of that can make people feel like they're unseen, or they're putting themselves out there and are being vulnerable, and it's not being that gift is not being appreciated. So one of the things is, as you get into this, and the other thing I will emphasize here is that, remember how we saw that the connection of the patient partner with the patient liaison, and this is not about one person doing this. This is about getting all of the folks on your team on the same page to know that these are tools that they can utilize, because it shouldn't be just one person all the time doing this, although certainly we can role model. So naming emotions when you see them. Here are some examples of what that might look like or sound like. I think if that happened to me, I might feel upset. How are you doing with all of this emotionally? How is this for you? You seem sad as you tell me this. Now, I know there are people on here, because I know you well, who do this just really naturally, and it's kind of part of your way of being. For others of us, it's a little bit trickier. These are examples of, and obviously you look at them, and if you saw someone who was outraged, you might not say, I think if that happened to me, I might feel upset. You would probably be like, I see where you're so angry. So you would, of course, want to tailor these and tweak these, but the naming of emotions is a really powerful tool for connection, letting people know they've been seen, and building commonality through relationships. So not letting those opportunities go by where someone is sharing all of this emotion in front of you and you're not calling out that you're seeing it. So naming emotions, one powerful tactic there for you. The next one, again, um, for some of you, it may be like, of course, Tara, but responding non-verbally. So the data on this varies. For a while, the standard was, 55% of communication is nonverbal. More recent studies have got it somewhere between 70 to 90% or so. But it is so much a part of our communication. And while nonverbal responses to promote empathy are not sufficient in and of themselves always, sometimes, but not always, they can be really impactful. So that might look like a pause, just a moment of silence where you're reflecting on what's been shared. And that can show that you're listening, not just to respond, but to hear and learn. It's something that can be really hard for people. I think of, all of these. We were just I was at a communication conference and with a small group that we're facilitating through personal awareness skills, which is what we call a lot of this. And we talked about silence and the pause and how hard that can be, but how powerful that can be for someone to be on the other end of that, to know someone's really absorbing what they've said. Touch, posture, and of course, this is only when it's appropriate. If you don't have that established relationship, that may not be something, you wouldn't want to hug someone you don't know terribly well unless you've asked them first if that was okay with them. But touch can be so powerful. I remember even from meeting with one of my physicians after my maternal event, and having that touch and what that meant to me. And to boot, research will tell you that all of the good stuff that's released in your body during touch, that's why we do handshakes. It really reinforces that connection between two people. Facial expressions, are you, do your expressions kind of match what the content of what's being shared? Making eye contact, the tone of voice you use, space, leaning in versus moving backwards, arms crossed, maybe standing while the person's sitting. So looking at our space and how we're connecting with people is another really important thing, to make this safe space, creating connection. That's how we do it non-verbally, is through these things. And as we go on to the next item, I want to see. Jennifer wrote a cool example here of a ground of health activity. We ask, what part of a salad would you be and why? Answers everything from lettuce to chickpeas to croutons to dressing. For example, lettuce because they want to build a base for others to build. I love it. I think we need to add that to the list. Thank you, Jennifer, for sharing that one. I really like that. That's an intrigue. I love to know the why behind these things always. All right. So the next tactic is we look at like this creation of safe spaces and what are things that we can do. We're going to walk through some pearls statements. So again, if we had a minimum of 4 hours together, we could do this whole relationship centered communication training that pulls together some of what we've talked about today, as well as many other things. But these are statements that are ways of responding in empathy with slightly different purpose depending on what it is. And of course, we had to have, an acronym for it, because how else are we going to remember all of these things that we are to remember? But so walking through and looking at some of these things, and I would imagine you can think of some examples, and I'll of course be asking you for your statements that you like to use or ways you might use these. But so the P in pearls being partnership. It's about linking arms with the person. So an example of a partnership statement could be, let's work together to identify ways that can help us prevent this from happening again. So that's an example, maybe related to after they've shared their story. You can think of more for all of these. You can see where it might be used as really, respecting, appreciating all of those things, these traumatic events that are being shared with us. They can also be used very pragmatically in terms of partnering with patients on quality committees and efforts, because I will be the first as someone who led a lot of work with patients and families in partnership. I have made a lot of mistakes along the way. And I have used these pearls for all sorts of things, including, on the pragmatic side again, maybe let's work together to find a time of day for a meeting that will work for you too, right? So it's the big stuff and the more logistical stuff. So that's partnership. We're going to do this together. Emotion, and this is related to, some of what we talked about, naming emotions as we see them and as we hear them. So an example of using an emotive statement to show empathy could be, it's frustrating to receive different messages based on who you're talking to. The A here, there are a couple of different things that could stand for. It may be an apology. I'm sorry that we haven't followed up on that action item. Or I'm so sorry that this happened to you in our hospital. Could be an appreciation. I appreciate you sharing this very personal story. I appreciate you finding childcare so that you could be here with us today. I think appreciation, this one in particular, especially when we're asking oftentimes for patients and family members to share with us what went wrong and their ideas for improvement. How can we make it better? There are some, I'm sure none of you do this. Some people in your spheres may get a little defensive when things are brought up, right? So I'm working with a very, 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 very large health system, the largest in the United States. And this is something we talk to leaders about a lot. It's the first thing you say when someone offers you an improvement idea. Thank you. Thank you so much for sharing this. Now, on the inside, you may be like, that'll never work. We tried that 5 times and, leadership will never support it. You may have all of those things in your head, but thanking someone for sharing an idea, which can be really uncomfortable, so uncomfortable, but always saying thank you. And certainly when they're sharing their most vulnerable, scary, devastating times, we should be showing appreciation for that. Also respect. You are a strong advocate for your family. Legitimization. I think as I think about that CDC article and people saying, oh, this is normal, this is, I think what we should be legitimizing is listening to ourselves, our bodies, and speaking up when something doesn't feel right. And so we should be legitimizing that with our patients that we're working with too. But so for example of this, a lot of people would feel angry if their concerns weren't addressed. So letting them know they're not alone. There's nothing worse, if you share a concern or something that's hard that you experience, and someone says, I have never heard of anyone having that happen before, ever. Like, I have never heard that happen here, ever. Do you think I am going to want to share one of my concerns again? I know. So, and even if it is something that you haven't heard of a lot, sharing that just, if that had happened to me, I would want to make sure it didn't happen to anyone else either. It's still affirming, still using empathy for these things that are being shared with us. Support. I'm committed to following up so that you have the information you need to determine how you'd like to move forward. So similar to the partnership, but also providing that commitment to, I know what my part is in this, and I'm going to support you. So these are some Pearl statements that when we look at the foundation, again, relationships and our ability to build those safe spaces, these are so vital. And one thing I want to note is that these Pearl statements, unless we are being really intentional in using them, really intentional, especially for marginalized communities, they are less likely to get a Pearl statement. Those folks who were sharing through that study that they felt like that had experienced harm, that didn't feel like they could communicate or should communicate, that they had been disrespected, or those are folks who likely were not receiving Pearl statements. They were not being told that we're in partnership together, or I appreciate what you shared, or I respect you naming your concerns. So with that, I'm wondering, we've got about 10 minutes left till the top, and I wanted to leave some space for discussion. Would still love to hear any phrases or other words you found to be effective, or you feel comfortable sharing, because not all of this is comfortable for folks. Like, I may be okay with saying you're a strong advocate for your family, but maybe saying I'm sorry is less comfortable for me. So I say something else. So let us know that in the chat box, but we can open things up, I think, for just general discussion and questions, thoughts, reactions. You unmute. Nicole looks like she's talking, but maybe she's not.
There we go. I could not get my unmute button. It disappeared on me. Thank you, Tara, so much for this discussion. I personally, I was like, oh my gosh, like my team, like I feel like, as co-workers and colleagues, and it's just so applicable, like you said, even for our families and home life as well. Sometimes we tend to, especially those that are closest to us, have even less empathy and patience and grace and all of that with our family members. They probably get the shortest end of our fuses, I will say. So this has been fantastic. If you have a question or a comment, you can either drop it in the chat or use the raise hand function, and then we can get you off of mute to share and comment. So I'm just watching the chat and seeing if anybody has anything or raising hands. Okay, Ro. So Ro's hand raised first.
Hi there. I just have a comment. You did an amazing job, and you have the perfect voice for it, holding space and making spaces safe. And I'm so thankful to Mama's Voice for doing this. So thank you, Nicole. I can definitely see how everything you shared will resonate deeply with patients. And being a recent patient of I just had a baby 5 months ago. I saw how my first provider, who I did not decide to stay with, did not practice this. And then when I moved to my new provider, I saw how clearly they attended your training. And now my midwife, she holds space so beautifully. And I feel like for her, it may come a little bit more naturally. But I think it's great that this is taught because I don't know that like if you didn't have the skills just naturally, I think it's great that it's something that you can learn. So thank you for doing this.
Oh, thank you, and I'm so glad that you panned over so we could see your little one, because I was going to ask you if you would be willing to if you hadn't done it. Um, One thing that you said that I think is really important to emphasize. I know, a lot of times when we do these webinars and things, it's a little bit like preaching to the choir. Um, but one of the things as we talk about communication and relationship centered communication, is that people tend to think like, oh, well, that's just a trait. Either you're good at it or you're not. But it's not. They're skills, and you can really develop them. And so, uh, we do different. There are different opportunities for, like, if we were doing kind of 8 hours together of this, it would also include some practice of these things too. I think it's interesting. As your experience, Ro, with your different provider styles and that. Um, it's either one of them would probably be very open to, oh, we got to do a simulation so you can get practice using this new technology, or we got to make sure that the checklist for patient safety, so let's run a simulation on that. We don't do that with communication. That's not something that's asked of them typically. And so that's something where for some of you who work with folks who are like, oh, I know someone who needs this, you can absolutely learn this. And it just takes practice, doesn't it? Yes, it does. Look at me
Thank you for
talking like,
illuminating that. I don't want to hog the chat. I want to quickly say that I'm glad that you said that because I'm a boy mom. I have 3 boys. And like sometimes I'm like, I'm just tough because I have boys. And I'm like, no, Ro, you can be empathetic. The boy fell off the bike. Don't be like, oh, again. Like be like, oh, I'm sorry.
ah,
So I actually looked at some of the wording. The powerful language really helps for someone like me who empathy may not come. Like I have to genuinely
yeah.
feel it to be empathetic. I mean sympathetic, yeah, because empathy can't be taught. So thank you for the powerful language.
Yeah. Well, and thanks for that great example of fall. Because the other piece of it is we learn what we see and what we've lived, and especially in when you talk about physicians, it's really like pull yourself up by the bootstraps and go on to the next patient. Like there is not room for feelings here, and so if that's what's been mentored to them, then that's another indicator. It's okay to not use this type of language. So that's another great reminder that you provided to us too. We got to shift things up.
Especially too, as some folks battle with like compassion fatigue,
Yeah.
you have to try harder, and it
Yeah.
becomes really, I'm with you, Ro. Like I have to work hard at it sometimes because we've been in this space for so long. And when you hear these stories, unfortunately, most of the stories that you hear and experiences from people, it's not the first time or the third time or the fifth time you've heard someone else that's had that exact same thing. And so it can be hard, but this is so necessary. And man, I'm like, thank you so much, Tara, for today, because I know you and I have been talking about this for so long, wanting to do this, and I'm thankful for the opportunity. And I'm just thinking of, I know this will be watched and replayed so much because I know I'm planning on sharing it out with different projects that people were working on for different things. So if they weren't able to be here today, it was really fantastic. I think we've got a few more minutes. If there's anybody else that has a question or a comment. I see Pauline in the chat said she really likes the Pearl responses. So that's a great thing. I know it's a little, it's more, I was thinking back to my, because I was talking about it earlier today when I was in college. I worked for one of the larger banking institutions in the country, and we had to do like 12-week onboarding training for customer service and using the feel, felt, found statements. Like, this is better than that, because I feel like so many people have heard feel, felt, found, that it's like, I know what you're doing to me. This just seems much more authentic and genuine. So I thank you for that. And I see Rhonda has her hand raised.
Hey, Tara, thank you for sharing today. I agree with Ro, your voice is amazing. Like, I was in a trance over here, so soothing. So thank you. The question I had is, with the providers that you work with, do you find oftentimes their struggle between time and being able to infuse that emotional space with the patients, because they're going through checklists, they're going through time constraints based on the amount of patients they're serving? You know, what things have you found with the providers that you've worked with?
That's such a good question. So here's the thing with it, there's a learning curve with anything that you're doing, right? So it may take a little bit more time up front. What we know about using the Pearl statements and responding with empathy is that it actually decreases the amount of time spent with patients. And here's why. I didn't do so. The Academy on Communication and Healthcare, their relationship centered communication training includes three different skill sets. But part of what is involved in that is eliciting what is most important to the patient. And so you're doing that, and then you're negotiating, like, here are the things as a provider are really important to me. So let's negotiate the agenda based on what's important to you, what's important to me. Sometimes they're the same things, a lot of times they are. And so when they are using these empathetic statements and engaging in hearing the personal story in these relationship centered ways, they're not having to go back and address things that didn't get addressed because they didn't ask the right questions and didn't fully listen the first time around. So it's it's a matter of minutes or something like that. It's not like it's this huge gap, because providers don't have a lot of time to go from patient to patient as it is. But it actually does improve efficiency rather than increasing time spent on one-on-ones. And yet it feels better for the patient. Yeah, great question.
Awesome. All right. I think we have just this last couple slides here. If you'd like more information from Tara, or to contact her, here is her information to talk with her about this and anything else. We love having Tara in our projects, and continue to look forward to working together. And then if you want to stay connected with us at Mama's Voices, our website's mamasvoices.org, and we will again be sending out the recording from today, along with it will be on our website as well. So we'll have links to that. And then the two previous webinars that we did, one was Navigating Risk Management with Candor, which was fantastic. And then also we had a nice panel of patient family partners, some of our lived experience faculty, that shared about working on the patient perspective with quality improvement projects. So we will have all of those up before the end of the month and let you all know. I think the series of webinars that we did were really valuable and had great content, and I'm want to continue doing things like this. So if you have any other topics as you're here today, love to hear from you. I'm always interested in what the audience needs and what your wants are and how we can meet those needs. So feel free to drop us a line and send us an email. So thank you again for today, for your time, and for spending your lunch hour maybe with us today. So thank you all so much. Yes, ma'am.